it's time for Health Tips Tuesday, and wait lists continue to grow for those in need of a kidney transplant, but only a small percentage are receiving such transplants every year. So what does this mean for all those people on a wait list? Well, joining us to tell us more about it about the continued problem is Dr. Kenneth McPartland. He's the Surgical Director of Kidney Transplantation at Baystate Health. How are you doing, Doctor?
Great, David. Thank you.
Awesome. All right. Well, thank you for joining us. The first question is about kidney transplants, and the people that are on waiting lists in the country continues to grow, with more than 90,000 people on that list, yet only 20,000 kidney transplants were performed. Why do you think that is?
Well, clearly more patients are in need of a kidney transplant than we have kidneys available to transplant those patients. So there's definitely a huge need for kidneys that we're currently not meeting.
Okay, and what do you think has been the biggest challenge facing patients who are on those waiting lists for kidneys?
The biggest challenge is those patients need to remain healthy enough and strong enough to undergo a transplant operation when they actually get an offer for a kidney. And that often takes over 5 years, sometimes upwards of 8 years on a waiting list. So these patients have kidney failure and other medical problems, and to remain healthy enough to undergo a transplant, in 5 or 8 years is very difficult. And unfortunately, many of these people don't have the option of undergoing a living donor transplant, which could be done right away and avoid all that time on dialysis and all the medical risks that go along with that.
And what are some of the things that people can do to help improve their kidney functions at home without medical treatment necessarily?
Well, I think a healthy diet, a healthy lifestyle with exercise and avoiding excessive weight gain, as well as getting good control of your blood pressure and really, seeing your primary care doctor on a regular basis and not neglecting that. Because the most common reasons for kidney failure are really high blood pressure and diabetes. And if you control those problems, you can keep your kidneys healthier, essentially. And we could decrease the number of people that actually end up needing a transplant. So that helps fix the problem from one end.
So what would you say to someone that is in need of a kidney transplant? What would your advice be to them as they're waiting for a donor?
My advice would be stay optimistic, try to stay as healthy as possible, and really talk to your friends and family about the option of kidney donation. It's very hard to ask someone to donate you a kidney, but really that is a life-saving measure for that patient, because many patients are not going to be healthy enough to undergo a transplant operation when their time comes, 5 or 8 years down the line on the waiting list. But if someone can donate to them today, not only does it improve their quality of life, these patients will feel better, have more energy. They won't have to go to dialysis, but it also improves their length of life. They're going to live longer with less medical problems after a kidney transplant compared to staying on dialysis. So I think stay healthy, talk to your friends and family about donation, and stay optimistic.
And if you are a donor, is that detrimental to your health? And if so, how much, if at all?
We know that healthy individuals can donate a kidney and live normal, healthy lives. There's a risk, but it's very small. So most kidney donors that are living donors do very well after donation and live normal, healthy lives and have a very small risk of medical problems or problems related to their kidney. And the transplant community is building in, more and more safeguards for organ donors. So if somebody donates a kidney and they, for some reason, end up having kidney problems in the future, even if it's not related to the fact that they had donated, if they ever were to need a kidney transplant, they would be placed right at the top of the wait list.
Oh, wow. Okay.
As a safeguard.
I did not know that. Well, thank you so much for your time, Dr. McPartland. That is all the time that we have, but thank you so much for joining us and educating us. We really appreciate it.
You're welcome. Have a good day.
You too. Thanks.